coming to this month's, got it, okay. Thank you for coming to this month's Ask and Tell with MSLs webinar. I'm only going to talk for a minute because I would like to introduce our new co-hosts. A lot of you have probably seen that Renee and I were talking about moving and transitioning to some new co-hosts. So Renee and I will still be in touch as, I guess you could say, webinar advisors. We're not going anywhere, but we are having two new people take over the monthly planning and hosting of the webinars. So that is going to be Gavin and Sonia. They are both currently PhD students. So you will learn a lot more about them. And I encourage you to reach out to them on LinkedIn and connect with them if you haven't. They'll be a good resource for you with anything regarding the webinar. So at this point, I'll turn it over to them and they can do a quick introduction of themselves if you guys would like, and then go ahead and start.
Absolutely. So it's nice to meet everyone. My name is Sonia Patel. I'm a fourth year PhD student in cancer biology at MD Anderson here in Houston, Texas. And I'm studying a little bit about different subtypes of lung cancer and mechanisms of resistance to immunotherapy. So it's been a great journey thus far in my graduate studies, and I'm really excited to be a part of this team for Ask and Tell with MSLs.
Hello everyone, so thanks for joining us this evening, and my name is Gavin Conley, and where the accent that you're hearing, I'm originally from Ireland, but now I'm in the US currently doing a dual PhD at Purdue University, so one in clinical nutrition and the other in gerontology. And then just kind of like probably a lot of people here, yeah, used to be one of the attendees at these events and just trying to learn as much as I possibly could about the MSL role and how to get into it and just network with people. So when the opportunity came up to help out with this, I jumped at the chance, and I'm just happy to help anyone out in any way that we can, as most of us that are here probably already in the MSL role are looking to break into the MSL role.
And with that, we're really excited to get started with this month's event. We're delighted to have Dr. Renee Rotolo Ph.D., who is the co-founder of the Ask and Tell with MSL webinar today as our month's webinar speaker. And she's going to discuss her own experiences being an MSL in her first year in this role. She's extremely passionate about sharing her experiences and knowledge and advice with those who are aspiring MSLs. And specifically for this month's talk, she wants to focus on the transition from academia to a field-facing role in biotech. And she'll give us some insight on all the key items that she's learned in her first year in this job. So with that, we're going to get started with asking some of the questions that you as the audience has sent in during the registration. And they kind of fell in a few different categories. So we'll start by asking some questions about the interview process and actually applying to be an MSL. So Renee, we wanted to start with some questions about what were some of the most challenging and unanticipated aspects of interviewing for the MSL position.
Yeah, thanks, Sonia. And before I answer that question, I just want to quickly thank the two of you for your excitement and all of your initiative in jumping on board so quickly and seamlessly. Lindsay and I are really excited to have you as the new organizers, and we're just super excited and thrilled to see what the future will look like for the webinar. So just wanted to thank you too. And thank you, Lindsay, for everything you do, of course. So the first question, what was the most challenging or unanticipated aspect of interviewing for MSL positions? I would have to say the most challenging is not knowing what to expect. It sounds really obvious, but you don't have experience. So you're going into this quite blind unless you do your own homework and your own research. So I would say my number one piece of advice for this aspect is to talk to as many people as you can that have actually been through the process. You'll get real life examples of potential questions that you may be asked or scenarios that you may be placed in. So I think that's the best way to prepare for an MSL position. And then I also think that one of the other unanticipated or challenging aspects is not knowing exactly the style of the interview before you're given the instructions, as many companies do things a little bit differently. So for example, so one company may ask you to do a presentation on one of their products or one of their trial outcomes. And another company may have you present on something that you are really familiar with. So such as your dissertation or an article that you read. So those are two vastly different experiences. And if you're going through the interview process at, say, one or multiple different companies, you'll have to juggle, I guess, the unanticipated nature of what the interview will look like. So those would be my top two most challenging experiences that I went through.
Okay, very good. Yeah, and then just leading on from that as well, just in regards to the interview process, we have a question on, so how did you prepare for MSL interviews?
Yeah, that's another great question. So I used every resource that I could find on the internet. So I already mentioned talking to people that have been through the process. That seems to be the most obvious. But also just do a Google search of, MSL interview preparedness questions, things like that, or MSL books that you can buy. There's a number of resources on the internet, on Apple podcasts, on Spotify podcasts, such as MSL Talk with Tom Caravella. I know on my way to and from the lab every day, I was listening to those episodes over and over again. So shout out to Tom Caravella. And then also just speak with current MSLs and then other aspiring MSLs and ask them what they're doing to prepare. I'll give a shout out to two of our previous speakers, Mike Moore and Dennis Schaller. You can go on YouTube and listen to their episodes. They're great. Those two people I had numerous phone conversations with, LinkedIn chats back and forth about, little questions that came up as I was preparing. So they sort of served as unofficial mentors among numerous other people. So yeah, use all the resources at your disposal and never stop asking questions to those who have already been through the process.
Great. And kind of following up with what you mentioned, there's a wide variety of different formats for some of these interviews. And we had a specific question from an audience member asking about your personal experience in your interview, and did you need to prepare a presentation, and what did that kind of look like? And were there a panel of interviewers that you were trying to cater this presentation towards?
Yeah, so I'll speak pretty generally to this question. I won't name any names, but so the two companies that I interviewed for were very different. One of them had me prepare a scientific presentation that was anywhere from 25 to 30 minutes with a topic that was up to my choice. So I chose my dissertation, a group of experiments for my dissertation, because obviously 25 minutes isn't enough. But I tried to make it as captivating and as relevant to the actual therapeutic area of the company that I was interviewing for, to show that not only can I speak to all of these different scientific elements in a short period of time, but also that I understand what they're looking for in a way that I can kind of match my experiences and my skill set and knowledge to what they're looking for in a candidate. So that was how I handled that one situation. The other interview style was, the company had asked me, we just published on phase 2 clinical trial results. Here's the citation or the reference to that article. Can you develop a 10 to 12 slide presentation on our data? So that was a little more challenging for me, because you're basically trying to educate or speak to a data set that's, one, not yours, and two, it was developed by the people that you're interviewing with. So you really want to try to impress them there. But so I struggled a little bit more with preparing for that one. But as I said, I spoke to other MSLs that have been through the process, and I said, what are some of the key elements to focus on, since I'm not as familiar with the important aspects to speak to in pharma. And I was told, a safe balance of safety and efficacy data, hit on all of the aspects of the protocol and the results and the discussion that you can glean from the article, and things like that. So two very different experiences, and unfortunately and fortunately, they happen within the same week of each other. So I was doing two totally separate preps within that same week. So I hope that answered the question.
Yeah, very good. And then just leading on from that, after you were kind of going through that interview process, or like with your presentations and stuff. So how was it that you ended up landing your first position, is one of the questions that we had from one of the audience members. And then it was just also asking whether it was with a recruiting or hiring manager take a chance on you. And last part is about negotiating, or did you take the first offer that you were given? Or another little thing I might add in is like about, I guess, networking and just maybe the importance of that, and if that played a role just in getting your first position.
Yeah, lots of great questions. I'll try to answer all of them, and let me know if I forget one. But I'll start with saying that I had networked enough to make connections that led me to be informed of the role that I have now. So I didn't necessarily get a referral through networking, but I was connected with all of the right people that ended up telling the hiring manager about me and my story and my interest. So that was how I was able to make the connections for my current role. The other role that I was interviewed for and ended up getting the offer for that I mentioned earlier was literally through applying in the job portal of that company's website. So I've heard many times that people such as former MSLs or whoever it must be says that, don't ever do that because it's a waste of your time. And I will live to tell you that that's not true. And it doesn't take very long. Once you already have all of your materials set up and established, you can throw them into a job posting. Make sure that it is relevant to your materials, and you should tailor it to the job posting. But I would suggest, doing that as much as you can. Every time you see an ad pop up, my strategy there was apply through the portal, but then also I tried reaching out to other current MSLs at that company, and also people that I thought may be the potential hiring manager. And it turns out that one of the people I messaged on LinkedIn was the hiring manager that ended up interviewing me. So I don't know if it was that strategy that worked, or if it was that I had a great overlap or degree of overlap of keywords in my cover letter and in my resume with the job posting. But I would recommend doing that because you never know what will happen.
Could I interject with a question that's related? I know that people say that, right? Try to find out who the hiring manager is. And I'm actively applying right now, for anyone that doesn't know. So sometimes it's pretty obvious, like it might even be posted with the job posting. But if it's not, I know how you can look up MSLs at that company, but how can you tell just from that who the hiring manager might be? Or are you networking with an MSL and asking who the hiring manager might be?
I think networking and asking could be a strategy. I had never tried that, but I think that's not a bad idea. There are some positions that may lead you to understand who the hiring manager are, like such as either a national field director might actually be the hiring manager at a smaller company, or field medical director might be managing a team of MSLs. And look within the specific therapeutic area at that company, because chances are if there's more than one product, there will be many different national field directors, or I guess probably one national field director, but many different field directors for the different therapeutic areas within the company. So just try to look for those types of titles.
Okay.
And then I forgot, there was that last question about negotiating. So I think it's all up to personal preference and how comfortable you feel with negotiating. I will say I had no experience and nobody taught me how, and I tried it and it worked. So I recommend doing it if you feel comfortable, but I think chances are, as long as you have a rationale for why you are negotiating and you can back up your rationale with data, there's a lot of survey data that's out there that's publicly available through the MSL Society and other societies. So if you have a rationale and or another offer that you can use to leverage, then I think it is worth it. But you also want to be careful. It's a fine line. If you already are given a good offer and you don't have experience, there are other things to take into consideration, such as stock options, benefits, compensation, and then how much you like the team and the culture is also really important. So I would say be careful, but if you don't have experience doing it, you're never going to get experience unless you try. So.
Nice. We have another question that kind of piggybacks off Lindsay's past question. So this is from an audience member who just asked, when you were networking, did you specifically target MSLs or did you reach out to other members of medical affairs teams, such as medical managers? And if you did so, how did your networking approach change, especially as you're reaching out to these very senior people?
That's a good question. I used a few different tactics for networking. So I mainly focused on reaching out to individuals that have similar backgrounds to mine. So it might be somebody in a neuroscience PhD program who may or may not have done a postdoc or a clinical research coordinator position, and then ended up transitioning into an MSL role. So that would be probably the best match. That's where I started. And once I spoke to several people in that realm, I thought, okay, now I know a lot about their path. I should try reaching out to other people, both in medical affairs and not in medical affairs. So I spoke to a few individuals in clinical operations, clinical development, asked them about what they did, because you never know who you speak to. It can actually end up helping you down the line. So just building connections with anybody that you can at a company that you might potentially be interested in working for later on is beneficial, in my opinion.
Okay, and then yeah, we just had in the chat just on this topic as well on negotiation. Somebody asked, was it done through email or what kind of way did you work that through?
I negotiate, and I had that conversation with the recruiter, or I guess the talent acquisition coordinator or specialist over the phone, because I think that conversation tends to happen, or at least based on what I've heard and in my experience, that conversation can happen as the verbal offer is given. So you're already kind of having a conversation, and you should know which numbers and which types of benefits and compensation you're interested in ahead of time. And then being just open and transparent as you're developing this relationship with the talent acquisition individual, so that you can have that conversation on the phone. Oftentimes too, you'll be asked about what is your expected salary range when you are in your screening interview. So, and what likely the person who screened you is also the person that you are developing a relationship with throughout the process. So you've already sort of set the stage with them, and they give you feedback on the expected salary range that you provide. So there's already an understanding of where both parties are at. And so you should feel comfortable enough doing it verbally. I think that's a better, and it's totally my opinion, but I think that is a better option versus email.
And one of our other questions in the application phase, someone was asking about references. So they asked, do you need letters of recommendation? If so, who do you ask other than your mentor? And have you considered asking other MSLs that know you well?
Yeah, that's a great question. I didn't know the answer to that going in either. I know some companies do ask for letters of recommendation, but the companies that I interviewed with did not. So I didn't have to provide any letters of recommendation. It was just the background check and the materials that I submitted. But great question.
Okay, and then yeah, just the last question we have on the theme of kind of the interviewing and application process. There's one here from someone that's a little bit specific, saying they're coming from sales commercial side, but maybe if we just keep it a little bit broader for the wider audience, just kind of experience and skills that you can show hiring managers for pursuing a career for an MSL in the future.
Yeah, so I've never been in that position, so I can't exactly give direct advice, but I would say generally speaking, my advice would be to leverage whatever experiences you have. So say you're on a sales or commercial team, you have experience talking to HCPs and or KOLs and or payers in the field. And hopefully the position that you're trying to apply into is within the same therapeutic area or a similar therapeutic area that you have experience in. So just try to demonstrate as best as possible that you've already begun building the communication skills and the scientific acumen that are required and relevant to the MSL role. And then, of course, any industry knowledge is important and is valued by the hiring manager. So if you're coming even from a sales or commercial role, that's definitely translatable to the MSL role.
Great. Kind of the next category of questions that we got from our audience was how you navigated the actual transition from PhD to the MSL role. And so first off, we'd like to ask, what's the largest challenge that you faced as a new MSL and all the learning that came with it?
Challenge. I would have to say learning how to be an MSL. So in specific, the science, because I stuck to what I know in terms of therapeutic area, I tried to land a position that was very close to the research that I have done, the research I'm familiar with, and the types of disorders or diseases that I have experience working with and learning about. So that part for me was a pretty seamless transition. But I would just say, in specific, learning how to develop and manage a territory, because I've never done anything like that before. And that is a really specific skill to the MSL role that you don't really get in many other roles, as far as I'm aware. So I would say learning how to build and manage a territory, and then also establishing relationships with KOLs. So you're new to the role. You may have a few pre-existing relationships with collaborators or KOLs that maybe your PhD advisor or your PharmD advisor had a relationship with. So you can still network within the MSL role to develop your relationship with KOLs. But just generally, learning individual KOLs' communication styles and preferences and learning how to navigate different types of scenarios is something that it's difficult to prepare for until you're actually an MSL. So I would say would be the most challenging.
Yeah, some great points, and I liked your first one as well, just learning to be an MSL, because it's not like there's any, grad programs or anything like that tailored for becoming an MSL. So yeah, that's a big challenge, all right. And then just leading on from that, in relation to a question from someone, just positions that recent grads should aim for in order to prepare for MSL positions, because as most of us probably know, it can be difficult to break in immediately out of your PhD. So just maybe some other roles to get that experience that would make you, I guess, just a better applicant for becoming an MSL.
Yeah, that's a great question. I can speak to the one previous role outside of my academic career in PhD and postdoc that I do have experience with, and that would be a clinical research coordinator. So before my PhD program, I was working at Yale in psychiatry and getting exposure to both sponsor-initiated trials and investigator-initiated trials in the schizophrenia area. So that gave me a really great understanding, or just, I guess, scratching the surface. I was there for 1.5 years, but in that time, I was able to understand the different aspects of running a clinical trial and all of the work that goes into protocol development and product adherence and compliance and ensuring that the tests are being done the right way and inter-rater reliability and all of those things that go into the work that we talk about as MSLs. So that was really great to bridge my understanding of the preclinical research world with what happens next, and then before we have all of the data to talk about as MSLs. But going back to types of positions, I know a few of my colleagues have had experience in medical information. So being a medical information manager or specialist is a potential role to look into. Also, clinical trial managers, it's a bit different from clinical research coordinator. That could be another option. And then many people also go into medical writing or science writing, medical communications or scientific communications. And that can be in like a consulting firm or in an advertising agency and or in a pharmaceutical industry, pharmaceutical company. And then if you're coming from the PharmD side, I know that many MSLs are previously retail pharmacists or clinical pharmacists. And then I know PhDs and PharmDs also have the fellowship route to take. And that's most likely a postdoc position, but there are also internships that you can do while still in school. But I know that, just a side note, when I was going through the process of preparing, I was looking into fellowships just to look for a position that would give me more context and more background about the MSL role. And there are more and more fellowship programs that are now opening up to PhD candidates or PhD students than there have been historically. I think they were primarily geared toward PharmDs in the past, but it's nice to see that more of them are open to PhDs now.
And then kind of jumping off that, we have a question specifically from a postdoc who is looking to figure out how to overcome the no experience once you've graduated with a PhD issue. And this postdoc has seen a lot of internships that are only available for students, but was really wondering, how do you leverage some key experiences as a postdoc that could land you the skills that you need for an MSL position?
Yeah, I think that's a great question because everyone always asks it. You can't overcome no experience without experience. So it comes up every day. Strategy I used is I tried to figure out how to best leverage 2 to 3 of my skills or qualifications that I've built, say, in my past career, past life, and then developing them out in a way that you can best describe, or I guess pitch them in a way that will demonstrate what kind of value you'll bring based on those skills. So in specific, scientific communication, and how did you get that experience, and what will that experience bring to the company? So if you've done oral presentations, poster presentations, if you've had a teaching assistant position, those are all ways to demonstrate that you have the ability to talk about complex scientific information to a diverse audience. So kind of framing it that way shows that you already know how to synthesize information and then communicate it either at a meeting or, like I said, in the classroom. So that would be one way to take that skill and show how you could demonstrate the value as an MSL. Like I mentioned, the fellowships are a really great resource to look into. And then another strategy could be, I was thinking about this earlier, and this is not something I did, but I think that as you're speaking to the individual that's screening you, whether it's the talent acquisition or the hiring manager, a good idea might be to ask them what the ideal candidate looks like from their perspective. And then if they give you 3 ideal skills, you could take that and try to match your experiences to those skills and say, oh, you mentioned leadership. Here are some of the positions I've held that have demonstrated my ability to be a leader. And so you can kind of take what they're looking for, and if you can show what you've done that matches up with that, I think that'd be an easier way to demonstrate your value without experience.
Okay, and then I'm just going to skip over the next one because that's a question I know you like to keep until the end. So we'll leave that one for last and we'll come back to it. But another question here, just in regards to, are there any aspects of the role that are different from what you expected now that you're a year into it?
Yeah, the one that jumps out in my mind first is being on Zoom. Many of you are in lab positions, I'm guessing, and at least in my experience, when the pandemic started, we all went home and we quarantined for a couple of months, but it was only for a couple of months and we were right back into the lab. So I think just being on Zoom and learning how to make that adjustment from being with people every day and also being on my feet every day and running around in a basement doing lab work and then sitting in an office every day, having Zoom meetings and doing my side projects all on the computer was definitely a big adjustment for me. And along the similar lines, just having downtime was also very new to me. There is definitely some downtime within the MSL role. Say some weeks you could have 10 meetings with KOLs and you're going to be really busy doing your pre-call planning and post work. And say you have another deadline coming up and everything falls in the same week and it's a crazy week. But then the next week you may have 1 or 2 meetings and that's it. And they're both only 30 minutes on Zoom. So there are other internal projects, like I mentioned, and side things that you have to do, but there also could be a few hours that you aren't necessarily very busy. And making that adjustment was honestly difficult for me because I had always been in my past roles just nonstop, a lot of hours a day and weekends, and that doesn't exist really in the MSL role. But I will say, there are some weekends that I am working because I'm traveling now for conferences. So it's just learning how to balance and organize your time in a way that you're being effective without overworking yourself, and then also without, I guess, underworking if you have a lighter week.
We have another question regarding therapeutic areas. And so you mentioned previously that you stayed within the same therapeutic area, but would you be able to speak generally about what your advice is about staying within there when applying to your first MSL position or branching out? And what's your general advice on how to approach that?
I think there are a few different approaches. I was comfortable in the neuroscience, neuropsych therapeutic area because it's what I know. And it's what I love. So I wasn't really willing to try to branch out for my first MSL role. But I know other people do, and that's completely up to you and personal preference. But I have heard hiring managers say, you can teach somebody how to be, or you can teach somebody the science, but teaching them how to be an MSL is a little bit more difficult. And so if you already have one of those two aspects, you're helping them out a little bit, or I guess maybe saving them time by already coming prepared in terms of scientific knowledge. And then learning how to be the MSL will then be one of 2 potential challenges instead of coming in with 2 challenges, if I'm explaining that the right way. But I knew that I wanted to stay in this area, but I guess if somebody is interested in a different therapeutic area, I'd say go for it. But you will probably just have to do a lot more work to become familiar and comfortable with the information in order to do your job effectively.
Okay, and then we just have 2 questions in the chat that are related, so I'll just ask them together. So one was asking about how often you need to travel as an MSL. And then the other question in relation to it was how many of your meetings in company and with KOLs are in person compared to virtual?
Great questions. So I'll answer the first one first. I travel less than some of my other counterparts across the nation, because what I've found and observed is that the Northeast and areas on the West Coast too are still fairly conservative in terms of meeting in person versus virtually. So very, very, very few of my KOL meetings are in person. I won't provide numbers, but it's not a lot. So most of my KOLs, I'll always give them the option. Now that I know that some are more comfortable, but it just seems easier, more convenient for them, and safer to meet virtually. So very few of my KOL meetings are in person. However, we have started going to in-person medical congresses and conferences and meetings. So you may have heard me speaking about this when you first hopped on the call. I just was in New Orleans for about a week. And that's one of the longer meetings over the course of a year, but we were gone for a while. And I know that some of the people I work with have small children and that could get difficult. I have a husband and luckily he's supportive, but I can see it getting difficult if you are, say, a single parent or something like that. And those are all things to keep in mind. But this year, if I had to put a number on it, I would say I have about 5 in-person medical congresses to attend, all of varying lengths. But I'm sure there will be lighter years and heavier years. And it also also depends on how many MSLs are on your team and the types of coverage that's required from meeting to meeting. So lots of variables, but I would say expect some travel. And if you are in regions of the country that are more open to it, then you should expect quite a bit of travel.
Our next question is, did you feel that your previous training has well equipped you with the skills that you need to be an effective MSL? And what are kind of the most key skills that you keep bringing up day in day through your job right now?
So I do. I think that the biggest skill that I had acquired during my PhD and my postdoc training is the ability to communicate science. And we do that on a daily basis as an MSL, regardless of if you have a KOL meeting or not. You are using that ability to take a really complex set of information and boil it down and make it digestible so that whether you're speaking to your manager or somebody in a cross-functional department, say not in medical affairs, it could be in human resources, or it could be in sales and commercial, or any of the other functions. You need to be able to understand how to best describe whatever you need to be describing in a way that's going to make sense to them and it's going to be impactful for them. So I think that was probably the most important skill that I had learned in my PhD, my postdoc. Also, I will say just relationship development in a lab. There are a lot of different personalities, and in academia in general, and in any other role, there's a lot of different personalities that you'll encounter. So knowing how to be adaptable and flexible and develop relationships with many different types of people is going to be key. And then third, I would say just your ability to manage projects and be organized. In my very biased opinion, I think there's no better person than a PhD student to take those skills and then be able to translate them out to other positions, because you're juggling so much over the course of 4 to 6 years. And as an MSL, you are too. They're just different things. So just being adaptable and being able to juggle and not multitask, but balance and prioritize in a way that is going to help you in your career.
Okay, someone also asked here, how did you deal with the marketing side of the job? So I'm not sure if that's referring to maybe thinking that you're doing some of the marketing of the product or interacting with kind of sales and commercial in that aspect. So maybe you could speak to kind of both of those topics.
Yeah. So I think it's getting at relationships with commercial colleagues, and which is obviously something new that I had to learn. So, but I will say that the company does not really leave any room for your own interpretation. And I think this is across the board. Compliance is the most important part of the MSL job. And so we learn about that on day one, and very regularly are there compliance touch points and checkpoints and things like that throughout the role. So, and it's not just with commercial colleagues, it's with the KOLs that you're speaking to, with the HCPs, especially if you are supporting a pre-launch product that's not on the market yet, which is my current role. So just a bit more on that. I don't really engage with commercial colleagues because I'm not dealing with a product that's on the market, but I'm sure I will be in the future. So it will be a little bit more relevant then, but you'll be exposed to it right off the bat, and you won't really have to figure that out on your own.
Yeah, some good points. And then I think just something to add in as well, just about the MSL role, just in case there's any confusion, is just that sales and marketing and the MSL role are very separated, and a lot of firewalls in place. And it's MSL is a non-promotional role. So very much just communicating the science compared to what's involved with sales and commercial and marketing.
Definitely.
Absolutely. And so kind of wrapping up the whole transition that you've had this first year as an MSL, what are some of the key takeaways that you'll be moving forward with as you think about how to improve as an MSL in the years to come?
Yeah, I think that's a good question. I don't really know if I have an exact answer to that, but we just did a workshop last Friday in New Orleans with an MSL vendor company that works to improve MSL communication skills and strategies and whatnot. And something that stood out from that is learning how to ask questions in a more effective way. So, for example, not asking yes or no questions or closed questions, asking, the whys and the hows and the whats instead of do you XYZ, because they can say yes or no and then not elaborate. But our job is to gather insights and to understand, the thoughts and the challenges of the people that we interface with. So asking questions in a way that will allow you to take in the most information and the most valuable information, but also that will allow you to learn more about the whys and the whats and the hows. So that's something that I'm going to try to focus on as I move forward. And then also learning to listen better is another thing that we learned about in this day of training. And just remembering that you're not going to learn anything if you're the one doing the talking. So listen, and this goes probably in every single aspect of all of our lives. Building relationships with people is a 50-50. You give, but you also take. And what you take away from your interactions with KOLs, with your peers, is only going to make you a better MSL.
Hi, this is Noah. Renee, good, excellent point. I was going
Thanks,
to
Norwood.
hello, everyone. I was going to allude to that because asking great open-ended questions is what you're alluding to is vital. And that keeps the dialogue going and also gives you to clarify their wants and needs or their misconceptions. So that listening skill aspect training that you're going to go into next, that's the core issue right there. So I'm glad you mentioned that. Excellent.
Thank you.
Yeah, and then just another question in line kind of with that professional development as you are an MSL. So just talking about looking at getting an MSL mentor, and then that since MSLs are on the field, also how to keep in contact with internal colleagues in the same company.
Yeah, that's an interesting question. I would say, it depends on what we mean by mentor. So there could be the mentor that you're engaging with before you are interviewed or hired. And that's more of an unofficial mentor that is maybe somebody that you met via LinkedIn. So I mentioned some people that I spoke to earlier. I would say there were many unofficial quote unquote mentors that I had along the way. And those are just any of the people that I ended up speaking to and asking questions and maybe having a short phone call with, or sending my resume to and getting their advice and feedback. There are many different ways to engage with people that will help you in a sort of a mentor mentee role. But then once you're hired, I know many companies, including the one I currently work for, actually assign a mentor throughout the onboarding phase. And if that's not offered to you, I would recommend asking somebody to be your mentor that's on your either on your team, a more senior MSL, or even on another team within the same company. And I'd be really straightforward and transparent with them and tell them what you think you'll end up struggling with, or some challenges that you foresee or expect. And they'll definitely serve as a good resource. So I was assigned a principal MSL on my team to be my mentor. We still meet, even though I've been an MSL for a year, and I still have questions that come up. Probably, can somebody mute?
They're discussing.
And then, so that's along the mentor line. And then to answer the second part of the question, how do you keep in touch with internal colleagues? I don't really know exactly where this question is coming from, but what I would say based on my experience is everyone within the company that I work for is always willing to have a conversation with you, especially because they know that I'm new to industry. So if you say, hey, so-and-so, you've been at the company for 5 years, and I see that you have all this really great experience. You've worked in multiple different departments. I'm curious about a job in a different department, and that's the way that you approach them. They will definitely extend their time to you and help you out. That's what I've never really had any issue communicating with people internally. And also there are a lot of company-wide meetings, especially since we're on Zoom now. It's much easier to get internal colleagues in the same Zoom room. So I don't think that will be a problem. But yeah, I would say just reach out to people, and they'll be willing to help.
Mhm.
We have this wonderful technical question that touches upon one of the harder aspects of being an MSL is engaging your territory and meeting those KOLs. So I wanted to ask what made a difference in establishing yourself in your territory to those new KOLs? What are the tactics that you tried to ensure a response from some of those KOLs that you really want to meet, especially those that might have been too busy to really read those initial responses that you were trying to engage them in that conversation with?
Yeah, and this comes up all the time, and I still don't know the answer, but I'll tell you some things that I've tried. So I speak a lot with my internal colleagues about this, and kind of the tactics that come up most frequently are obviously, number one, email them again if they don't answer. But what you can do when you try emailing again is changing up the style of the body of your email. So maybe it was too long. And I've found also that certain providers appreciate when your email only has one sentence in it versus a few paragraphs. And that's difficult to do if it's an introduction email, but try to understand where they're coming from and how much time they may have. They might not want to read 3 paragraphs. So being concise in your email, I think, is really effective. You can also try changing up the subject heading. So we all share subject heading titles that we use, and I've tried a few different ones. I can't say exactly which one has worked the best, but even just changing it from email 1 to email 2 to the same HCP could help maybe catch their eye a little bit better. And then trying to meet them in person. I know pre-pandemic, this was much more common. MSLs, I'm sure Norwood might have a little bit to say on this, but MSLs used to actually, so I'm told, used to go out and knock on doors and go and speak to the receptionist at an office and get FaceTime that way. But that definitely, based on what I've seen, has not been the experience or the culture right now. But now that we're traveling again for meetings and conferences, you can, find a KOL at the coffee shop and strike up a conversation that way. And maybe that's going to be your first touch point. And then emailing the KOLs that will be attending the in-person meetings and trying to see if they have a few minutes to meet with you, so that you can talk to them about, say, the work that they're presenting. But I would say emailing, and then you can also call. You can call offices and maybe speak to a receptionist and ask like what the best time would be to try to get in touch with a specific KOL or clinician. Yeah, those are my 3 main strategies.
If I can add one other great point you mentioned there, first of all, to everyone, but if I can mention another great strategy to save time when you did meet them, once you did meet them, whether on Zoom or face-to-face, to build rapport with them a little bit sooner. I used to ask for their CV or their resume, getting an idea on their CV discusses a lot of great information. What other areas of interest they have, what papers they published, who are some of their gurus that they respond to, who is their chief resident. In other words, great information on their resume, and what that says to them, that you're really interested to know them. You're not pitching anything. You want to get to know them on a different level. Some MSLs they have a hard time asking for it. But I find that was a great resource for me, and it gave me leverage as to which direction I should be going when I'm speaking with them. Just a
Yeah.
suggestion.
Really good points. No, I like that.
And I guess just to tag along with that, some advice I've seen and people have found useful is just maybe things like leveraging LinkedIn and maybe just seeing if they're posting on that or any interest, or some people are more active on Twitter and maybe just like following them on Twitter and just kind of seeing what they're putting out and just maybe getting a conversation going then in person with that is another way. I just had another question myself for you, Renee, and it's kind of just maybe giving everyone more of a bigger picture overview of kind of like your first year in the role, maybe like your first 3 months if there was training, and then maybe 6 months to 12 months and when you were out in the field, or if you're like shadowing any MSLs or anything like that along the way, getting experience.
Yeah, that's a good idea. It may have been better to do this in the first place, but that's okay. So I was exposed to an onboarding period, which was around 6 or 7 weeks long. Like I mentioned earlier, it was all via Zoom. So I would meet on a regular basis with many of the different members of my team. And I was given a mentor, so we would meet on a weekly basis. But in terms of materials, all of the materials are broken into modules. So I was given a very structured week by week, I guess, schedule, we could say, of goals and strategies that I should be able to hit each week. So that's sort of like what the content aspect of it looked like. Then I had a certification exam, or it was an oral exam at the end of it. And then I was field certified from there on out. So once field certified, and actually starting in the final 2 weeks of my onboarding phase, I had the opportunity to do virtual ride-alongs with my colleagues. So I would probably say I did around 4 before I was certified with all different MSLs on my team. And that was really great. I know most companies do that, but I think some may not offer it right off the bat. So that would be really great to ask for when you first get your MSL role, because it was super helpful just hearing how other MSLs on the team speak to the data that you've been trying to read for the entire day, every day for those past few weeks is huge. It contextualizes the information, and it also gives you really good insight as to what types of questions KOLs are asking and what information they're most interested in. So that was my favorite part of onboarding and the most beneficial part of onboarding. After that, once I was field certified, I was free to go. And so I was basically essentially provided a list of historical KOLs that the company had relationships with. But I know that this varies a lot from company to company, depending on how long the company has been working in that particular therapeutic area will determine whether or not there even are past relationships, whether the company works with a vendor to establish these territory lists is also another factor. And then a lot of it's also left up to you. So even if there are KOLs that the company has relationships with in your set territory, it's still your job to identify new leaders in the field and up and coming KOLs that, maybe are not on the radar yet. So there is a lot of personal research that you're doing on the back end to develop your list out. So that was a lot of the first few months of my field certification time. And from there, now I'm building out my list. I have a handful of relationships that I feel really comfortable with and I learn a lot from, and they feel comfortable with me too. So I think the moment that I realized, okay, maybe I do know what I'm doing, is the first time a KOL reached out to me for information. And said, like, I really loved our conversation that we had a month ago. Let's meet again. I want all the updates. And that felt really good. So that's basically my year in a snapshot. And now we're traveling a lot. So getting to engage with some of the KOLs that I've built virtual relationships with has also been really rewarding, and just bringing things full circle and learning what a difference an in-person interaction can make has been really eye-opening. Just body language and tone of voice, and they're willing to give a lot more of their time, I've found, if it's an in-person meeting. So that's been fun, seeing, you know, both meeting styles and learning which KOLs prefer what and that sort of thing. But I hope that answered it. I think I went off on a bit of a tangent, but that's what my 1 year has looked like.
Renee, one other quick question to ask,
Sure.
maybe would be willing to share. Have you had any workshops on presentation skills in the sense of the manager playing the KOL and you being the MSL? And have you shared that already? I don't know if you, I came on a little late. I don't know if you mentioned that or not.
No, I don't think I mentioned that. And that was a big part of my onboarding, actually. So
okay.
I had done a few mock interactions with other senior MSLs in the team, and that was immensely beneficial. So they were the HCP or the KOL, and I was the MSL.
So has your manager integrated that in for continuing training? In other words, training continues on after that 1 year. In other words, if you found that to be successful for you, and maybe some others it didn't, or I don't know, but I'm just alluding to the fact that maybe that might be a great resource for continuing for practice, because there's so many different scenarios, so many different responses, and it keeps you sharp. You know, because you're going to meetings, you're doing training, you have policy exams, but yet still you need that other skill set to be focused, because sometimes your interaction, as the group may not know, you're not meeting for an hour, you're not meeting for half an hour, it might just be 10 minutes or 15 or 20 minutes. So that means you have to be on point on what you're going to ask those great open-ended questions, and then whatever response she or he mentions, how are you going to channel it? And you get that to practice.
Yeah, I couldn't agree more. I'd say that we haven't had very structured, I guess, mock interactions like I was mentioning in the onboarding. However, we do get together every time there is a new data readout, and we've engaged with the first few KOLs each. For example, we'll get together and talk about challenging questions that we've heard in the field, and then we'll just kind of workshop on answers that we've tried, or answers that have, you know, worked, or people will bring their own challenges to those meetings, and we'll talk about best practices and things of that nature. So we are doing it to a degree, and I think it's really important to make that point that it's helpful for new and very experienced MSLs, because
exactly
yeah, there are new questions all the time.
Hear your voice on that. You'd be surprised other who don't want to speak up, and they say, oh, I'm so glad she mentioned that.
Definitely. Yeah, thank you.
And we have one more concluding question. Now that you have 1 year in the books as an MSL, how has your view on the trajectory of your career looked? Where would you like to take the experience you gained and kind of move forward as you think about elevating or sticking with the MSL role?
I knew this question was coming. I would say I'm still just so curious about all of the other roles that are out there. So I say this to all of the aspiring MSLs that reach out to me. I've loved my 1 year as an MSL, but there's so much more out there. And there's so many other roles that I still don't know about, but also roles that I've learned about already in just this past year. And I don't know if there's really a way to ever learn about them all until you're actually in the MSL seat, or in whatever your first industry role is. You'll be exposed to roles that you never even knew existed. So in my future, I'm going to continuously just keep learning, keep asking questions, keep setting up meetings with people internally. Just a fun tidbit, we do these things at our company called Random Coffee. And you are set up with somebody else that works at the company on a monthly basis. And I've met so many people now at the company through that mechanism. So that's one way that I'm continuously learning. And I don't know, I guess I'm not quite sure where I'll end up, but I don't I don't really know that I want that answer at this moment, because that means that I would be pigeonholing myself or putting all my eggs in one basket. And I just want to keep finding out what else is out there. So never stop being curious, I guess, is the takeaway.
Right.
Are there any other questions in the chat, or have we addressed them all?
Yeah, that's all the questions that were in the chat and that were here from previously before. So there's one question usually like to end on if no one else has any questions they'd like to put in the chat, or if anyone wants to speak up, feel free now. Give people an opportunity if they want to ask a quick question, as we're just up on the hour. Okay, it doesn't sound like anyone, but I know one question you usually like to ask guests that you've had on before is, what's one thing that you wish you would have known before becoming an MSL?
I'll sort of piggyback off my last response, if I could. I'd say I wish that I would have known that I didn't need to be as nervous about breaking in without experience, or just about how my interactions would go, even with my internal team. What I've observed is, like I mentioned earlier, everyone's willing to help. They want you to succeed. There's not that, I mean, I think that I know I'm lucky in my current position, and maybe other companies might not have this type of culture, but they want you to do well, because you doing well will help the team do well, which eventually helps patients do well. So there isn't really that kind of, there aren't really any obstacles that I faced interpersonal wise. And I know that I'm lucky to say that. But I wish that I would have known that I didn't need to be as nervous, and that I knew I was going to be coming into a supportive nature and a supportive environment. And even if it wasn't supportive, always know that you are not stuck there. If you're not happy, you can just leave. So those are all things that I wish I knew too. Take a deep breath. You don't need to be nervous breaking into the role. You will get the support and the help that you need. And if you're not, then that's not the right place for you.
It's not competitive on the, it's competitive on the commercial side.
Exactly.
But one key point that I think is fair to mention, if you're part of the Southeast, Midwest, Northeast, different sectors want to be the lead sector of the company. And that's important when it comes to merit raises, bonuses. So that's the only competitive part, is that the whole group wants to do well. So your group that you represent in your geographical area for so many states, they want to be the lead of the United States. So that's why everyone wants you to do so well, because then we all benefit. So that part of the puzzle, we always remember.
That's a good point. And it's also very different too. I'll just add, if you're working on a product that's not approved by the FDA yet, if you're in the pre-launch phase versus the post-launch phase, I think some of those, I guess, sentiments could be a little bit different, to Norwood's point. So not quite sure. I'm speaking to my experiences only, and but I hope that helped.
And then the last point, I don't want to overkill, but your manager is striving to meet his or her metrics versus the other managers. So that's important. And it trickles down and trickles up. So just a little reminder. Thank you.
Thank you.
Yeah, thanks, Norwood, and thanks, Renee. Do you have something to say, Sonia?
No,
I
I
just need to
just want
unmute
to say
yourself
thank
there.
you so much. Yeah.
Yeah, I was going to say, any concluding remarks, I guess, then, Renee, unless anyone else has anything?
Thank you for sharing. Thank you.
You're welcome. Thank you all for being here. I'm open as a resource to any of you. Some of you have reached out to me in the past, and you can feel free to continue to do so. I really like speaking with aspiring MSLs now that I have some experience. I love sharing because so many people gave me their time before I was hired. So I want to definitely give it back, and pay it forward. So please reach out, connect with me if we're not connected, and stay in touch. And let us all know when you get your MSL jobs, because you all will.
Yeah. And then, yeah, I'd like to just take a moment as well, just to thank you, Renee, for being our speaker this evening. And then also to you and Lindsay for being the ones who started this webinar series. And I think this is the about 2-year anniversary now since when you actually started it. So it's been a great resource that I've found extremely useful, as well as I know many others too. So yeah, I just want to thank you and congratulate you for that and on your first year as an MSL.
Thank you.
Yeah, it's great. Yeah, and then yeah, I just want to thank everyone who joined us as well this evening for being a part of the talk and joining us for our 2nd year anniversary and Renee's 1-year anniversary as an MSL. And then, as she said, yeah, feel free to reach out to me or Sonia or Lindsay here as well. I know is open to being connected with on LinkedIn, so feel free to reach out to us. And if you've any suggestions or comment, or Norwood, yeah, we got Norwood as well, who's a great source of information. So and he was just given the signal there to say it was all good. So you can also reach out to him or any one of us, or if you have any suggestions for the webinar, for future events that you'd like to see, we're open to those as well, and more than happy to hear from you. And then yeah, just give us a follow on LinkedIn as well, on the Ask and Tell with MSL page, where we post about the events and just people who get any jobs related to MSLs that are in the community.
Great. Well, thanks so much, Gavin and Sonia. And thank you all for being here.
Thanks, everyone.
Thanks, everyone.
Bye.
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 Bye, guys.